Hello, I'm Dr. Chaudhry. I'm the Residency Program Director for our OBGYN training program at Marian Regional Medical Center. I want to thank you and welcome you to our interview session. I appreciate your interest in our program and I hope to be able to share about our training with you. We're a 3-year-old program and we're obviously recruiting for our 4th class. We're excited that you're considering us, and I think it's really important that you get to know our culture and our identity. And while I believe, and I'll hopefully demonstrate to you, that we're going to give you excellent training throughout your time here, I really think what differentiates us is who we are and our culture, and I'd like to emphasize that. Let me tell you a little bit about myself. My wife and I lived in Baltimore, Maryland. We were there for about 10 years, and I was residency program director at a different program there. We enjoyed our time there. We were happy. I really enjoyed the work I was doing, and we really didn't have any good incentive to leave the area. But then this happened. Eli came along. So he's now 3 years old. He's about the same age as Marian's OBGYN residency program. And that kind of made us reflect on our priorities and our values and what we wanted to do with our lives, honestly. And we wanted a place where we could raise him and feel good about it. And at the same time, we'd always sort of considered, my wife and I, moving to the West Coast. This opportunity arose about the same time that our son was born. Marian decided to start a residency program in OBGYN. I became aware of it, and I became very intrigued and interested in the idea of developing a brand new program from scratch, honestly. I thought it would give us the opportunity to create something exceptional, and that is what I hope to share with you today. So as I share some of my personal reasons for coming here to the Central Coast, I'm hoping that perhaps these will resonate with you as well, and you might consider that these are important to you. We love the ocean, we love the beach, we love the mountains. The weather's great, pretty much 99.9% of the time, which is fantastic. I don't miss the Baltimore winters. I can't imagine taking my son out in the snow, and too much work. So we enjoy the lifestyle here, we enjoy the pace here. I feel confident, my wife feels confident that this is a great place to raise our son. We love the family feel and we love the community. Let me tell you a little bit about why the program decided to establish the residency. It starts with the hospital and the community, a critical relationship. The hospital and the community have honestly worked together to serve each other for probably over a century now. The nature of the relationship is such that the hospital is committed to taking care of our patients in the community, to serve them. And quite frankly, there's a particular emphasis on taking care of the poor and the disenfranchised. It's one of our core values that we attend to that need. At the same time, perhaps because of that aspect of the hospital contributing to the community is extremely supportive of building and developing the hospital. In particular, there was a recognized need for OBGYNs to serve this community in the years to come. That was recognized by community leaders, community members, and the hospital responded to that. We decided we would support them by trying to develop our own OBGYN program with a strong intent to try to retain our graduating residents. As you learn about our program, I think that's a theme you'll hear over and over, that we hope that once you're trained here, you may actually consider wanting to live and work here, serve this community, and hopefully be here long term. As far as the institution and what inspired me to come here to consider a program that had not yet been developed but was being envisioned, let me share some of my thoughts with you. My goal, our goal here, is to create an extraordinary training experience. I want to sort of highlight that word, experience. It's not just about your training, not just about the skills you'll acquire, but it's a full-on 4-year immersive experience. It's about learning our culture, it's about connecting with individuals, it's about your wellness, and it is also about excellence. You'll hear more about this as I share some of our thoughts with you, and I think it's critical that you understand how committed we are to this experience for you. My educational philosophy. I think it's been considered a little bit unique, but I also think it's at the forefront of graduate medical education. I think it's where ACGME wants us to go. And personally, I think it's how medical education should be envisioned. And that is this. In the past, as program director, I may have considered test scores, transcripts, as perhaps some of the most important indicators of how we should recruit residents. Those are still very important elements in our application recruitment process. However, those are perhaps not the critically most important elements that define what an excellent OBGYN resident and physician would be. And that has permeated the philosophy of our program. I fundamentally believe that wellness, support, and encouragement of learners is the proper design for a residency and graduate medical education program. I don't believe that there's value in creating a tense environment that makes people sometimes feel uncomfortable. That may happen. There are pressures. We work through difficult circumstances in this field, but it's really important to make it such that the resident always feels supported. That means emotionally, physically, psychologically, intellectually. So that might be one of the defining features of our program that differentiates us from other places. It's something we truly believe in. Additionally, when I first came here, I realized that the people around here were fully committed to creating a residency program. That's talking about administration, that's talking about faculty, that's talking about people like Dr. Oates, who is our director for medical education here. And I felt like there's an opportunity here to achieve this vision, this unique vision about graduate medical education. The people, some of which I'm referring to, are shown over here. These are tremendous faculty members. They are here for one reason. It's a new program. They chose to be here because they wanted to be a part of it to train you. And I'm very proud of our faculty. And on this screen, on the top left, you see Dr. Tamala, GYN oncologist, exceptional educator, exceptional surgical educator. We're grateful that he's here. Dr. Yin brings experience, brings leadership, and an incredible passion for teaching. Drs. Moss, Dr. Song, somewhat newer to the faculty program, but again, thoroughly committed and only here because they want to make the program better. And Dr. Crisp, one of our generalist OBGYNs, he is such an advocate for your learning. And finally, I wanted to show Dr. Ann Kennard, who is our champion for wellness. And she is truly committed to making sure we don't in any way neglect that element of our training. Not able to show all of our faculty. We could spend some time doing that. Hopefully you'll be interviewing with some of them today and you'll get to meet them. But let me go on to our goal for this program. So you've kind of already heard, we expect you to be excellently trained. We want resilient clinicians, surgeons, and even leaders. And I'll show what I mean by that. So Marian's program is fully accredited by the ACGME. I think that's important to note, given that we're a new program. We've gotten the highest level of accreditation that our program, given that it's 3 years old, could attain. And that should give you great confidence in our future longevity and stability. Procedural volume, tremendous volume. We deliberately chose to have only 3 residents per year when we probably could have afforded to have more. The mindset being that that will allow each of our residents to have plenty of volume. I'll give you an example. Our brand new third-year residents now have already achieved the required numbers of procedures for vaginal deliveries. They're very close to achieving those for C-sections. They've been doing probably more than many other places in terms of their GYN experience, the number of hysterectomies they've done, and they're excellently trained and very capable surgeons. I would be willing to bet that in my experience professionally, where they are, our residents in their abilities as surgeons is considerably advanced, given our commitment to that element of their training. We have multiple modalities of simulation: obstetric simulation, robotic simulation, laparoscopic simulation, tremendous pathology in the area, which of course creates opportunities for learning. We have strong leadership and commitment from leadership to support the program. We are committed to scholarly activity that includes both research as well as quality improvement projects. And I'd like to make a comment about our didactics, which essentially what we do is we do a survey of our residents when they first get here to try to understand what is the best way in which you would learn. Is that through case-based discussions? Is that through online webinars, through modules on the web? and then we adapt the learning to your style of receiving the information. And we found that to be extremely valuable to our residents. So let's get into some of the details so you can understand some of the structure of the program. I wanted to compare what the early part of your residency might look like to the later part. A really important element, and perhaps something unique to our residency, is that for the first between 4 to 6 weeks of your residency at Marian, we've committed to protecting you in a rotation called Introduction to Clinical Obstetrics and Gynecology. During that time, my expectation is that I know you're an excellent academic candidate. I know that you know how to acquire the information. I know that you have the abilities that will allow you to be successful. But I don't assume that you come in with a great deal of OB/GYN knowledge. And what I mean by that is that you may have done your last OB rotation 10 months prior to starting residency. I don't expect you to come in and know all the details about preeclampsia or the different modalities for surgical management of hemorrhage. I want to review that with you. So what we do is we spend a focused, probably 30, 40 hours of interactive learning time where we go over those concepts to give you a really strong framework within which then you can proceed to go to the clinical wards. So in that month, not only do you get plenty of didactics, you get simulation. We introduce you to the OB service, the GYN service, the clinic rotation in our office setting, and do it in such a way that you're honestly not primarily responsible for clinical care at that time. You are learning, you're being exposed. And we found that to be an incredibly valuable transition for medical students turning into first-year residents. In addition, consistent with our theme of valuing your well-being and teaching you how to perhaps manage the stresses of life and residency better, we commit to a program for stress and resilience training. And that is something Dr. Kennard, whose picture I shared with you earlier, helped develop. And the idea is that we want to give you the tools that allow you to be successful and also manage challenges that can occur during residency and that can make some of the time, difficult in terms of challenging patient outcomes or other types of stresses. Additionally, you'll have 4 months of obstetrics in the first year, 2 months of GYN, 2 months of night float, and then the remaining several months are a combination of a breast rotation, a NICU rotation, and a medicine rotation. In contrast to that, if you look at your more later years here, you'll find that it transitions to more GYN heavy training. The 6 months of GYN refer to 2 months of general gynecology, 2 months of urogynecology, and 2 months of GYN oncology. And that is sort of the transition from the early part of your training to the later part of your training. All right, let me share some hopefully fairly quick pictures and stories behind the pictures. So 3 years ago, Chris, Becca, River joined our program, our first ever interns who are soon to be chiefs, which we're extremely proud of. On the top right, they were doing an orientation during that first month of residency, learning how to scrub, learning how to position patients, learning how to manage the operating room environment, understanding the culture, not only of interacting with others, but also understanding principles of safety in the OR. Bottom right, each of the residents, including Chris, I wish I had his picture, was taught how it feels to correctly position a patient, but also to sort of share what that vulnerability for a patient may be like. They seem to be having a good time. Then we went to the next year, and Ali, Steph, and Susie joined us. They kind of had a similar orientation experience. They seemed to be enjoying it. And I thought this was an important slide to remind us of pre-COVID times and hopefully post-COVID times. This was when we could interact with each other less than 6 feet apart and enjoy social activities. We wish we could do more again. We're trying to figure out creative ways to do that at our program. But here are the different residents that I shared with you. You know, at the bottom right, River and Becca are going to a national conference, if I'm not mistaken. It was at Hawaii. You know, it's a really tough training program, and a release like that can be extremely valuable. I mentioned leadership earlier. A couple of our residents, Becca consistently, and then Chris and River have alternated, are members of ACOG Junior Fellows and specifically leaders in our district as ACOG chair and vice chair positions. They had the opportunity, again, pre-COVID, of going to Washington, D.C. and of meeting political leaders and advocating for women's health care. They learned how to be leaders in a political sense as well as advocacy, in addition to having that rich experience for themselves. The top right slide is the ACOG National Conference that was held a couple of years ago. One of the things that we wanted to do, and I believe we're going to continue to do, although it didn't happen in Seattle this year, is to have our residents attend the ACOG conference. I kind of think that might be a nice retreat for the residents to attend that. It's a 3, 4, 5 day break from the work. There's great learning opportunities there. And at the same time, honestly, it gives us an opportunity to connect and learn together. And this is the connection and I suppose the learning that I'm referring to. So at that previous conference, we weren't able to go last year because it was all virtual. Here we are doing what we like to do. Food, nutrition, eating, probably some wine there too. You know, that's how we let off some of our steam. We enjoy it. We enjoy being together in those kind of settings. And you can see lots of smiles. And I think that demonstrates a lot of our commitment to the well-being and being able to learn while also balancing play. All right, then we come to our third class, Danny, Maya, and Jennifer. And these are their professional photos. And their experience started off online, virtually. So bottom right is me interacting with them before they got here and starting to get to know them and planning out what their orientation would be like. And obviously we've all adapted to the virtual world and we're trying to do that today as well with this interview. When the interns finally arrived here, this is a picture of their workroom, their resident workroom, and the current residents, the second and third years, had prepared a bag, I guess a welcoming sort of, I don't know what the term they use, but something to acknowledge and welcome the residents. It had some comic elements to it. There, you see the wine bottles there. They were gifted to the residents. We don't allow drinking on campus. And it was a really touching and sort of caring, I think, gesture from the current residents to show support and welcoming of the new residents. Another picture showing that this is actually during our interactive didactics. And you see that there is, I guess what I'm trying to demonstrate is that there's learning, but there's also enjoyment in it. And this is my last slide. And while I've talked a lot about wellness, I want to make it clear that you're going to be working hard. The hours are long. It's intense. There are times when residency will be difficult and we'll be here to support you. But at the end of the day, we want you to be exceptional OBGYNs. This is Chris and River as second years doing a laparoscopic case. I'm really proud of this image because it kind of encapsulates what our educational mission is. 2 junior residents with the ability, under the supervision of an attending, to take on a surgical challenge like that. Shows me that we are training them as they need to be. They have the skill set, they have the judgment, and this is what our goal is, for you to graduate being exceptionally trained. So with that, I want to thank you for considering our program, and I think we'll move on to the remainder of the activities for the day. And if you'd like to reach out to us, we'll provide our information, and I want to thank you again for considering Marian.